Hi, my name is Michelle Bigg, and please enjoy my continuous quality improvement plan presentation. So for overview, we're going to go over what a continuous quality improvement is, the goal of the CQI, the specific aims, plan, do, study, act overview, and the results of my CQI. According to the National Learning Consortium, the CQI is a philosophy within healthcare that helps to encourage all individuals to identify ways and processes that can be more efficient, effective, and timely. So a CQI goal should be measurable opportunity that needs improvement. And this is typically based over core values. And I have identified that my core value is self-care is necessary in order to be an optimal healthcare provider. And I've noticed in the past couple months, there's been an issue of increased tiredness due to lack of sleep. I noticed that I've been using my phone and tablet at least 60 minutes prior to bedtime and going to bed much later than I typically used to. And I've been decreasing the amount of sleep. So my goal of the CQI is to turn off my phone and iPad 1 hour prior to going to bed to help increase my time and quality of sleep. I believe this is important for my overall health. It'll help to increase my ability to perform daily activities, as well as increase the alertness and mental acuity I will be able to perform at my peak. Data collection, I will log the time I place my phone in the kitchen, and then I will also log the time of night I fall asleep and wake up according to my Fitbit. I also plan on utilizing my team member, my boyfriend, to help with the goal of my CQI. He made a New Year's resolution and was able to start putting his phone in the other room and not using it prior to bedtime, which has been definitely helpful with him and his sleep quality. So he was a great motivating factor. The specific aim of my CQI project is to turn off and not use my phone tablet at least 60 minutes prior going to bed, and I plan on doing this by placing it in the kitchen so I'm not distracted about it. And my specific aim was based off of the STEEP model, which is, according to the Institute for Healthcare Improvement, is safe, timely, efficient, equitable, and patient-centered. When I evaluated my goal, I noticed that having more sleep will increase my safety by having more energy, which will in turn make my output more timely, efficient, and effective. I utilized the Plan, Do, Study Act for my model. The plan portion is developed to plan is developed to test the change you identified. The do portion is where the testing is performed. Study is where the observations and learning from consequences of the changes are identified. And act is the modifications that are made and a plan is implemented to help continue this improvement process. So for the planning phase, I evaluated my current sleep habits. I went back on my Fitbit and looked for the past month, and I noted that I was getting about an average of 5.8 hours of sleep per night. I also looked at the different phases of my sleep and noted that I was in light sleep at least 85% of the night. I started looking at my own behaviors. I was using the phone. If I couldn't fall asleep within 15 minutes, I would start looking at my phone again. I'd make excuses to look at the phone. The scrolling makes my eyes tired. I'm reading something else online that's going to distract me from my other anxieties that I've been experiencing. So I definitely believe that there was a lot of change behaviors that I could go forward with. And then also there were some health changes. I had recently gone to the eye doctor and I moved 2 more steps towards nearsightedness, and they think it's from using the phone so often. So definitely is affecting my health. I also did some research on different studies, and I found a great study that went over the use of light-emitted electronic devices before bedtime can prolong the time it takes for you to fall asleep, delays the circadian clock, suppresses levels of melatonin, reduces the amount and delays the timing of the REM cycle, and reduces alertness for the following morning, which are definitely things I think I've been experiencing. I also read on Harvard Business Review, there were some different helpful tidbits that they could help with my goal, including the not using the phone before bedtime by putting it in another room, which I've been doing, dimming the room lights an hour before I go to bed to help increase melatonin release, and reading a paper book. And then also Psychology Today said that the average adult over age 18 should have 1.5 to 1.8 hours of deep sleep a night for every 8 hours, which I definitely was not getting. The due phase started on Sunday, March 10th over a 3-week period. I decided to start on a Sunday because it's the beginning of the week and I felt I would be more motivated if I started at this time. At this time, I logged how many hours I would sleep, how many hours of deep sleep I had, and how many minutes I would put my phone away prior to falling asleep. And I did this all by my Fitbit. And overall, I was able to put my phone away for an average of 54.2 minutes prior to bedtime over the 3-week span. My total average hours of sleep increased to 6.9 hours, and my total average of deep sleep went up to 1.6 hours, which was within normal limits according to Psychology Today. So on my study phase, I analyzed the different patterns. So week 1, I was very motivated in the beginning of the week to put the phone in the kitchen, but then in the middle of the week, I had a little bit of a family issue. I was stressed. I kind of fell back onto old routines and was using the phone to distract me again at night. I saw that it was easy to fall back into old patterns no matter how motivated I was, but actually having the log and seeing the data in front of me really helped to motivate me again. And I noticed that my range was about 43 minutes off with putting the phone in the other room, which was much more significant than I would have liked. For week 2, I feel like I was much more consistent with putting the phone in the kitchen, same as week 3. And the range, I believe this was because in week 2 and 3, I really relied on my team member for motivation and reminders of putting my phone away, he putting the phone away too, and us doing it together, which was a great motivating factor. For week 1, I noticed that I slept an average of 7.2 hours, which is a lot more than I typically do, but then I noted that it was skewed because I slept a lot more on day 6 and 7. I did notice that I had more consistent weeks 2 to 3, and I do think it's because I started to read novels before bedtime. Taking the phone away from me 60 minutes before, I kind of felt like I didn't know what to do with myself, but now having something to replace that made me more tired, made me more relaxed, and helped me fall asleep was a great way to help with my goal. I noted that having more consistent sleep versus variable sleep was an improvement. I felt like when I had more, the same kind of ranges in my sleep, I felt more rested, able to perform my daily activities better, greater potential, and I was actually able to go to the gym after work several times a week after work, which I hadn't been able to do very often. And then I noticed some patterns that I do sleep more on the weekends and my sleep decreases as the week progresses. I think that's because I'm more stressed about deadlines and work and school for the weekend. And I think that having more consistent patterns of sleep definitely does help me. So this is something that I learned about myself. Below is the data for weeks 1 through 3 non-phone usage when I put the phone in the kitchen. So averaged about 54.2 minutes, like I said, putting it in the kitchen, which was great for me. I thought I wasn't going to even be able to do 15 to 30 minutes. And the ranges did improve for weeks 2 and 3. Attached is the data for weeks 1 through 3, the hours of sleep that I had. So I was getting around an average of 7, almost 7 hours of sleep, which is a lot higher than the 5.8 I was getting before. So definitely did feel a difference, and the ranges had improved for all of them. And then this is a bar graph of my sleep analysis and the days that I sleep more, total sleep in versus deep sleep. So my goal was almost achieved. I had 54.2 minutes average of turning my electronic devices off and placing them in the kitchen, which I think is amazing that I was able to actually do that. I noticed that the setbacks in week 1 did help motivate me. Seeing it in on paper and being able to track it, I was able to analyze my behaviors, and it made me a little bit more motivated to move towards my goal. And then I noted that I can apply this in other facets of my life. I'm going to try to start doing this for motivating myself to go to the gym, also eating less sugar and drinking soda, which is another goal that I'm working on. And then I believe I can implement it at work too. I help coordinate patient care for oncology patients, and I think using this type of system will be very, very important in helping them as well. So in conclusion, I was very close to achieving my goal, placing my phone in the kitchen at least 60 minutes hour prior to bedtime. Definitely did help increase my sleep quality and duration. I've noticed that I've had a healthier lifestyle since starting this goal, and it has motivated me for the future. Thank you so much for listening to my presentation.